The need for emergency contraception is increasing of late, and in the emergency contraception la what are the best methods to use அப்படின்றத இந்த வீடியோல டீடைலா பார்க்கலாம். Generally emergency contraception க்கு there are two methods available. அதுல first is the pill and second is the intrauterine device. So pills la there are 2 to 3 options which we have, and first one common எல்லாரும் கேள்விப்பட்டது is the I pill. இந்த I pill la levonorgestrel அப்படின்ற ஒரு progesterone content இருக்கும். And second available is ulipristal acetate. இந்த டேப்லெட்டும் நமக்கு emergency contraception help பண்ணும். And third thing, usually இது ரெண்டும் அவ்வளோ commonly available இல்ல, over the counter நமக்கு கிடைக்காதுன்றதுனால there are sometimes we prescribe the contraceptive pills in a higher dose, and இதை நம்ம USP method அப்படின்னு சொல்லுவோம். Coming to the intrauterine device, we have two options. One is the copper T, அதாவது copper intrauterine device, and second is the hormonal intrauterine device. இதை நம்ம மிரினான்னு சொல்லுவோம். So first thing, before using an emergency contraception, what we should know is this is not a primary plan of contraception. You should always have a primary plan of contraception, either the pills or condom, and sometimes இதை நம்ம மறந்துட்டோம் யூஸ் பண்ணல அப்படின்னா then it is only an alternate option, but it should not be followed on a regular basis. So in the emergency contraception, pregnancy வரதை எப்படி prevent பண்ணுதுன்றதை நம்ம பார்க்கலாம். First thing, pills will prevent pregnancy by preventing ovulation. அதாவது egg ovulate ஆகத இந்த tablets prevent பண்ணும். And usually in the pills is most effective when we take it within 72 hours after the unprotected sexual intercourse. So நம்ம after 72 hours எடுக்கும் போதோ இல்ல already ovulation ஆயிடுச்சு அதுக்கப்புறம் நம்ம pills எடுக்கிறோம் அப்படின்னா most probably it might not work, and definitely if your period skip you should have a pregnancy test done. And usually in the pills when taken before ovulation or 72 hours after unprotected intercourse, 70% of the time it can prevent a pregnancy. But emergency contraception la best method is the intrauterine device. Both the copper intrauterine device and generally in the copper T or Mirena, up to 99% of the time it can prevent your pregnancy when inserted within 5 days of the unprotected sexual intercourse. And idhula இன்னொரு advantage என்ன அப்படின்னா you can have it for a prolonged period, and futureல the need of emergency contraception or pregnancy happening is very less when you go for the intrauterine device. And in the intrauterine device எப்படி pregnancy வரதை prevent பண்ணுது அப்படின்னா usually it prevents the implantation. அதாவது எக்கும் ஸ்பெர்மும் மீட் பண்ணதுக்கு அப்புறம் the embryo will come and get implanted in the uterus, but அங்க since we are placing a copper T or an hormonal IUCD, there is difficulty in implantation, and இது மூலமா pregnancy வரது prevent ஆகுது. But all these methods are helpful only before a pregnancy happening. Once you test positive for pregnancy, அப்ப போய் நம்ம இந்த emergency contraceptionோ copper Tயோ யூஸ் பண்ணும்போது definitely it will not cause an abortion. So despite using all these methods, ஒருவேளை உங்களோட periods delay ஆகுது அப்படின்னா definitely consult your gynecologist, and they will get you checked whether you are pregnant or not. If at all they find you pregnant, it is totally your choice whether you want to continue the pregnancy or go for a medical termination of pregnancy, and based on your choice your gynecologist will help you.